Hi everybody, welcome to the True Crime Nurse. My name is Kat and I'm a registered nurse who loves all things nursing and true crime. Today's story is an extremely disturbing case about 24-year-old Elisa Serna, who was neglected and abandoned while in police custody. What I haven't mentioned yet is that she was pregnant. She died as a result of the jail's negligence. This caused charges to be placed against a nurse and 2 doctors, an internal investigation, and a $15 million wrongful death settlement. This was the largest in San Diego's history. I'm actually really surprised to see that this hasn't been covered in the true crime space just yet. So thank you, Naner Boppers. We're going to insert the screenshot here for the suggestion. All right, everybody, we're going to jump into today's case using our SBAR format as always, but please be sure to watch my Rex Hewerman video if you're not sure what that means. Also, please subscribe, ring the bell, like the video if you like it, and comment down below any case suggestions that you have or constructive criticism, and we will give you a shout out. You guys, we grew so much since we last saw each other, and I genuinely wish that I could hug each and every one of you. Thank you for being here. You genuinely will never know how much this means to me. On November 6th, 2019, a young woman by the name of Elisa Serna walked into a store and walked out in handcuffs. Elisa was arrested for suspicion of theft and drug charges because the store clerk stated that she was attempting to steal a bottle of liquor, so he called 911. Elisa was then taken to Las Colinas Detention Facility in Santee, California, where she admitted that she was under the influence and pregnant. She reported to the police that she was addicted to heroin and alcohol and was a daily user. Elisa also stated that she had drank that day, taken Xanax and opiates about a couple of hours prior to her arrest. According to her mother, Paloma, though, Elisa had struggled with addiction since she was a teenager. She was only 17 when this all started. Shortly after arrival, Elisa began to show all the hallmark signs of withdrawal. She was sweating, vomiting, and clearly unstable. We're going to be diving pretty heavily into the nursing aspects of this case because I feel that it's really important that you actually get to see the whole picture and understand how deeply Elisa was failed while in jail. Now, like I've mentioned in the past, this will not be the place to shame anyone's life choices or struggles. We need to keep the comments respectful because this is a safe place for all of us and you never know who is watching this video. Now, a little nursing knowledge on the withdrawal process. Withdrawing is an extremely dangerous process on the body. The risk for seizures and even death are really high for sometimes the first 12 hours through the first several days. That's why you need to be closely monitored. And the severity will depend on the progression. Your body quite literally tells itself that it cannot exist without the substance of choice. Now, into today's case, Elisa seemed to have been struggling with more than one substance, so the risks for complications for her are even higher. Let's add pregnancy on top of it. Does anyone know what pregnancy does to the body also? It's seen as a stressor. Your brain, heart, and every other aspect of your body is working on overtime to grow a person. 2 comorbidities or co-occurring conditions happening at the same time will both be seen as a stress to the body, and that should have been extremely concerning to the medical staff at the jail. Combine these scenarios, and as a healthcare professional myself, this patient would have been my top priority. No life circumstance or setting should have allowed it to be seen any other way. When you're in a state of stress and withdrawal, all of your vital signs get thrown off. You can hallucinate, seize, and more. This is why it's essential to have frequent assessments and interventions throughout this process by the medical staff. Some of these interventions may or may not include environmental changes to avoid overstimulation, because that can trigger a seizure, IV fluids, an NG tube that goes in the nose into the stomach to suck out its contents so that you don't vomit and aspirate as a complication sometimes of seizure as well. You would also perform close vital sign monitoring and medications when needed. Depending on how critical someone appears, patients sometimes even get put on a ventilator and admitted to the ICU in order to control some of the effects that are happening in their body from the withdrawal, and it also helps to avoid further complications. Scales and tools that we have as healthcare professionals actually help us to determine the risk level. So why didn't the jail staff use these tools? Elisa needed to go to the hospital. Why didn't the doctors use them? Now, to bring it back to Elisa, shortly after arriving, she was determined to be at risk for complications, and they decided to send her to the infirmary or the medical ward unit in unit number 5. This is different from medical isolation. The medical ward is nearly identical to actually what you'd see in a hospital, just with additional safety measures in place because they're in police custody, or in the jail's custody, I should say. Elisa remained in that ward in unit number 5 for November 6th and November 7th, treating her nausea, and she was given water orally and told to increase her water intake. As I've already mentioned, IV fluids are what you should be given when you're vomiting, and it's the best choice to rehydrate based on this circumstance because she can't keep the pills down and she can't keep the water down. How can someone hydrate, especially while pregnant and withdrawing, if they're unable to keep the pills in their stomach long enough to help them? She continued vomiting for several days per the court documents, which would obviously result in worsening dehydration. Prolonged dehydration can cause electrolyte disturbances, which paired with withdrawing and seizing absolutely means that she needs to be brought to the hospital. Electrolyte disturbances require close lab monitoring and sometimes also heart monitoring that I highly doubt this jail was capable of providing her. While under direct supervision, Elisa vomited 64 times, had 11 grand mal seizures, and fell 18 times, yet she was still in a cell where she could walk around rather than be resting and being closely monitored. We already talked about what stress does to the body. So, adding in the dehydration element only prolongs and worsens these withdrawal symptoms. Despite having ongoing seizures during this time, she had no safety measures in place. In the hospital, when someone falls, especially during activated withdrawal protocol, this warrants an immediate workup to make sure that they're okay, typically including head imaging, consults, medications, an incident report, and anything else necessary to make sure that the patient's okay. Part of withdrawing protocol is that in the hospitals, it's treated like a fall risk. So they've got a floor mat in case they do fall, and then they instruct you to call if you need to get up. You could have a wristband, a call light instructions, and education to remind them to call for help because their risk of falling is high. An additional measure is to have mats on the bed rails. But despite her not receiving fair or appropriate treatment, after November 7th, Elisa was transferred to medical observation, where she was in her own cell without the consistent assessments that she required. It states that Elisa continued to receive withdrawal medication after the transfer. Despite the ongoing medication, on November 11th, the court paperwork states that Elisa had persistent symptoms of withdrawal and dehydration 4 days later. Witnesses in the jail stated that they observed Elisa stumbling around, unassisted, falling, vomiting, and on her hands and knees and struggling. She banged on the door and pressed the help button countless times without any response. The doctor on call, Dr. Von Lintig, reported that she thought Elisa was faking it for attention, as most inmates do. This doctor assessed her remotely watching the camera and made that snap judgment. During this time, witnesses, one being a registered nurse, stated that at 1:15 in the morning, she had 4 more seizures without any response from the medical staff or guards. Elisa begged to go to the hospital and begged for an IV to be hydrated. This is just torture. During Elisa's final hours, around 7 p.m. per the court paperwork, 2 jail personnel watched as Serna suffered a seizure, struck her head, and fell unconscious onto the floor of her cell. The personnel looked, then left the cell without providing any medical treatment, end quote. On November 11th, 2019, Elisa died while in police custody in a medical isolation cell after lying on the ground for an hour without assistance despite witnessing the head strike. Why is it that she laid there on the ground for an hour without help? The nurse that checked Elisa was Dana Lee Pasqua, and she was attended by Deputy Lovisa per the jail's safety requirements. Did the nurse check her vitals? Nope. They shut the door on Elisa as she laid there slumped near the door of her jail cell where she laid there to die. Mr. and Mrs. Serna were notified of their daughter's passing over a phone call from the jail clerk. No police escort to their house. Paloma stated, "I found out through the clerk that my daughter was found dead on the floor. Her head was banged. And then with us seeing the video, we saw that there was even more to that. So how can we trust them if they're doing things like this? They're lying to us." Elisa Beatrice Serna was born on 2/25/1995 to her parents, Michael and Paloma Serna. She was raised in both Nevada and Southern California along with her siblings. Her mom said that Elisa always kept to herself and was more of an introvert, but once she hit her teen years, her personality really started to emerge more. Paloma said that Elisa loved swimming. She enjoyed riding her bike and had a very nurturing spirit about her. She was described as a great, smart girl by her parents. Elisa's sister said that she would give you the shirt off of her back if you needed it. Although she had amazing qualities, she did succumb to the pressure that comes with teen years, sadly. Elisa started dabbling with drugs and alcohol, and this is when the monster that we know as addiction grew. At the age of 21, Elisa had a child, and she loved her so, so much. Elisa's daughter was 3 years old at the time of her mother's death. Following the loss, Elisa's toddler was legally adopted by Elisa's parents, so her grandparents, and continues to be with them to this day. Elisa's mother stated, "She has her child that she loves so much, and she was robbed from her family. Her daughter was robbed from ever seeing her mother again." Something that Paloma shared that I noticed was not really reported on heavily is that Elisa wasn't being given her anti-addiction medication while in jail. Shocker. These medications, I'm not sure if you've heard of them, like Suboxone or Methadone, they're actually federally regulated substances that help those that struggle with addiction safely wean off of their drug of choice. Missing these medications, however, could result in withdrawal, given that Elisa also had other substances in her system at the time of her arrest. This is yet another way that the medical staff at Los Colinas Jail failed her, because I believe that administering this medication, it may not have fully prevented the symptoms, but I think it would have made the withdrawal process easier on her and potentially could have avoided this unnecessary crime. Just like the hospital, the jails are supposed to supply and administer daily medications. So how and why was it that she was denied this right? Now, we're going to move on to our assessment section where we start to kind of go over some of the legal portion and findings. But after post-mortem exams were completed, it was ruled by the medical examiner that Elisa died of natural causes related to substance abuse, with a contributing factor of early intrauterine pregnancy. Before we talk about what happened with each staff member that were charged, I'm going to actually read to you some of the documentation that was released because it is so disturbing and damning in this case. The first note. On November 10th, 2019, 11:21 a.m., respondent entered a note in patient A's medical record as follows. Patient was never transferred for her withdrawal. On Zofran now and will order Vistaril. This note means that patient A was never treated for her withdrawal from alcohol, benzodiazepines, or heroin, and that patient A is currently taking Zofran. The next note. On November 11th, 2019, at 1:15 in the morning, a nurse's note in patient A's medical records provides in part as follows: emesis, or vomiting, ×1, clear liquid. Per other inmates, patient A continues to induce self-vomiting into the trash can and on the floor, clear liquid, skin pink and dry. Ambulation steady, normal gait, no shortness of breath, breathing even and unlabored, no shakes or tremors noted, mood irritable with episodes of agitation but cooperative. Patient was transferred from the ward to isolation cell due to disruptive behavior. As patient was being escorted by the deputies to the cell, ambulating with a normal gait, she was yelling excitedly, "I can't walk," although she was walking with bilateral strength in her lower extremities and normal gait. Denies other acute or chronic medical issues, agrees to go back to housing. You guys, to break this note down a little bit for you, the nurse is trying to paint a picture of deception, allegedly, when she states that Elisa was making herself throw up, but also that she is pink and dry. That is our nursing way to say that someone is hydrated. She then describes her as disruptive and documents that she basically had no real signs of withdrawal and would intentionally contradict Elisa's cries for help by documenting that she was okay with her steady gait and no shortness of breath. She again discredits Elisa by saying that she couldn't walk but had bilateral lower extremity strength, meaning Elisa was lying because her legs appeared fine to the nurse, allegedly. Next note. On November 11th, 2019 at 2:14 p.m., Dr. V wrote another note in patient A's medical records in part as follows: emergency add-on. Was taken out of isolation room in medical observation and placed into a wheelchair in order to be taken back to housing as discussed this morning. When patient suddenly moved backward in her wheelchair, stiffening up her entire body and no longer responding. Was taken down to the floor and placed back on mattress in her room. Apparently was holding her breath after ammonia was held under her nose for some time to wake her up. Oxygen saturation initially 87 with essentially otherwise normal vital signs. When patient woke up, she was alert and oriented ×3, breathing regularly, speaking in full sentences, but noted to have very cold hands and feet. Ativan 1 milligram orally had been ordered earlier by another provider upon arrival at the scene before this examiner arrived, and it was eventually given to the patient who had no other complaints except for having felt weak again. Denies history of withdrawal seizures. I roll, you guys. To me, this documentation really does reflect how poorly Elisa was treated and neglected by the staff at Los Colinas. Nobody responded to even a single cry for help or sign that something was truly wrong. Why wasn't 911 called after it was documented that she was continuing to seize and vomit days after arriving? Elisa was clearly unstable and not responding to the treatment or lack thereof. This is such an injustice. Dana Lee Pasqua is the registered nurse that was on duty on the day of Elisa's death, and she was charged with involuntary manslaughter and pled not guilty. Pasqua failed to assess, respond, and help Elisa after she collapsed and hit her head. Rather than helping her and reassessing her after her head was struck, she walked away. As soon as her work was aware that she was being charged, she was suspended, rightfully so. Despite the prosecution's best efforts, she was acquitted on all charges. Dr. von Lintig, though, was charged with involuntary manslaughter for gross negligence and failure to care for Elisa properly. She has since surrendered her medical license. Deputy District Attorney John Dunlap stated that after examining Elisa, Dr. von Lintig did next to nothing in terms of treating her, aside from placing an order that Serna was to remain under observation in the medical observation unit. Why? She documented that she had finished alcohol and opioid withdrawal protocol, but you guys, this is clearly inaccurate. She was still seizing. Witnesses saw and testified to her ongoing symptoms. Fun fact, even after symptoms resolve, you typically still require monitoring for an additional length of time afterwards because the chances of rebound symptoms are still there. Despite her seeing the seizure on camera that day, she still chose to go home at the end of her shift rather than go assess Elisa herself. She abandoned her completely. Paloma stated that she was relieved that she can never harm or kill another person by having her license revoked, and she felt like the community was safer that way. Carol Ann Gilmore, another physician that was actually working at the prison that day, was also charged with involuntary manslaughter as a result of Elisa's death. While Elisa was having a seizure in her wheelchair, that story that we talked about a little while ago, Dr. von Lintig was responsible for Elisa's care, but was outside smoking. Because she was not available, Dr. Gilmore ordered for Ativan to be given to her to treat the seizure. She's the one who put that order in for the 1 milligram of Ativan. And you can sense the frustration that she had because she was busy in her clinic in another area while Dr. von Lintig was outside smoking. And she stated, "I had to leave my patient naked to go over there and deal with that." Are you kidding me? She pled not guilty because she was not the physician caring for Elisa, but only stepped in for a brief few moments. The medical board filed accusations against her because of this. Now, you guys, this part's so frustrating. I feel like this is just heartless, but Dr. Gilmore decided to surrender her medical license and said this to the media that it was liberating because she was 70 and wanted to retire anyway. Let me know if that rubs you guys wrong like it did me, because to me, it just gives off the same energy as I didn't like you anyway when someone gets rejected. But it's way worse because of what this all entails. We lost someone's life. But upon an internal investigation, also known as the San Diego County Critical Incident Review Board, or the CURB Board, it was found that San Diego County has had 35 incidents where inmates died on their watch between November 2015 to December 2019. So it's just a 4-year period. This investigation confirmed the horrifying details that we already discussed. That staff denied Elisa the necessary treatment. They witnessed the event when she fell and hit her head and denied her medications. They also did not even attempt to call 911 or transfer her to the hospital. They failed to save her, and they confirmed it. As a result of these findings, it was ordered that the department turn over the video footage from the jail, and in addition to that, all their internal files. This is a statement that was released by San Diego Police Department. We support the district attorney's decision to file criminal charges in this case, which centers around the actions and decisions of individuals who were entrusted with the care of Ms. Serna. Those actions do not reflect the values or obligation of the Sheriff's Department to keep people safe when they're in our custody. Our sheriffs, healthcare workers, contractors, deputies, and other staff members perform at exceptional levels every day. They go above and beyond their duties, regardless of the challenges they face. The Sheriff's Department is committed to providing compassionate medical services for the safety, health, and well-being of everyone entrusted in our care. We have and we will continue to follow strict protocols for investigating and responding to allegations of misconduct." End quote. That was a difficult read, knowing what we know now. After it was ordered to hand over the video footage of November 12th, capturing Elisa's final fall, I have to say, you guys, this was tremendously painful to witness, so I can only imagine how Elisa's family felt. Paloma stated that when she saw the footage herself, she didn't want to be here anymore, if you know what I mean. I'm not going to actually show the footage or the portion of the video where life-saving measures were attempted, but it's public and on YouTube if you want to go watch. I will say, though, that seeing her without any assistance for a prolonged period of time, then the staff's response after finally checking her goes against everything that you learn in this field. Anybody that's ever learned CPR knows that you try to wake someone first in distress briefly, then you check their pulse for just a few seconds, then you immediately get on the chest and start compressions. As we've discussed in prior cases, every additional second that goes by before you attempt CPR drastically reduces your chances of saving someone's life, and this staff knows that. Their credentials tell me that they know that. I know that Elisa was already gone, but you guys, I'm not saying this because I think that she could have, maybe been saved. I'm saying this because they failed to respond. The reason that I point this out is to once again highlight that there was no compassion, care, or appropriate responses shown to Elisa, and she did not deserve that. Nobody deserves that. Elisa's family created a beautiful website to remember her and post updates. Not only does it have pictures, news articles, and so much more, but it also actually has a countdown to show that the judge ordered the sheriff's department to meet with them by June 28th of 2025. The clock's ticking. The family advocates to facilitate change within the system to prevent these unnecessary losses from continuing, but the sheriff's department has yet to meet with them. In the end, Elisa Serna's family was awarded $14 million by the county and $1 million from Coast Correctional Medical Group in the wrongful death lawsuit, making a total owed to the family $15 million with the assistance of their attorney, Grace June. The litigation process for the wrongful death lawsuit took 5 years. That is a long time for this family to not have their justice or feel any semblance of peace, if that's even possible anymore. I want to share with you some of Paloma's words because I want to make it clear that no amount of money in the world can fill the void of losing a loved one, and especially not a child. That's her baby. Paloma stated, "I hate holidays, especially on Mother's Day and, on my daughter's birthday. These are reminders that I do have another child, but where is she? Where is she?" Elisa is remembered by her child, her parents, and her siblings. There is no reason or excuse out there as to why Elisa was failed horrifically by the staff at Las Colinas. She should still be here. That money never mattered, and it does not replace Elisa. If you made it to the end of the video, drop a case that you want me to check out in the comments. We do have a list growing, but keep them coming. I mentioned it in the first video that there'd be a mixture of cases, that some focus more on nursing and some will be on current or major cases, but I promise you guys, I will always incorporate nursing tidbits whenever I can. But I'm considering covering Karen Reed next, so tell me in the comments if you guys have any interest in that case, or do you think it's kind of overly being covered right now? Please be sure to take good care of yourself. Nurses' orders. Bye.